Welcome back, viewers. And now I am joined by my special guest on the show today, Sana Dabo and Fode Cisse from the National Association of Gambia Nurses and Midwives. Welcome to the Fatu Network, Sana Dabo and Fode.
Thank you very much.
Thank you very much for coming to the platform. Of course, there is no healthcare without nurses, and it will be ridiculous to actually even go into the role that you guys play in any healthcare system. You know, the entire world, I mean, every healthcare system in many countries right now are struggling as they fight the raging pandemic. They are stretched right now. And then we have you people still fighting for the basics of things like, decent pay and all of that. Tell us a little bit about, this association of nurses in the Gambia.
Thank you very much. The National Association of Gambia Nurses and Midwives was established in 2004. Was actually there in 1996, registered with International Council of Nurses, and also Midwives Association was there to also register affiliated with International Council of Midwives. So in 2004, the association realized that these are two people working on the same role and having the same goals, and they now try to bring them together, irrespective of the care difference, to have one family, one association that will represent the interests of both nurses and midwives. Because having a midwives and having a nurse, a general nurse at the same time, working side by side, having the same goal and objective, which is a patient care. I think it is important that we come together and amalgamate your ideas to have one big association that will represent the interests and the welfare of the entire nurses and midwives.
And to talk about the interest and the welfare, I understand that you guys had a press conference today to address some of the struggles that you people are faced with as nurses working in the healthcare system in the Gambia. What was the press conference about today?
The press conference was about the allowance, the proposed allowance that the association made since last year, and also the unavailable materials that nurses and midwives use to work. Those are the PPE, those are the personal protective equipments. For the allowances, the National Association, since we came into the office, we understand that the allowance that was paid to nurses, it has been there since before myself coming into the nursing school. And I came to the nursing school, I became a nurse, and this allowance is still there. Like, for example, an allowance of $200 was designated for a facility in charge or a nurse that is responsible for entire facility, for entire health center or hospital. That nurse, and also an on-call allowance is for $200. This has been there for decades now. A nurse will be working from 8 o'clock to 4 o'clock. That's where your shift ended. And now your on-call starts from 4 o'clock till 8 a.m. in the morning. You'll be sleeping, they'll call you, the patient will be at the labor. You have to go and take care of this patient. Emergencies will come, you have to leave everything until the end of the month. Then they'll pay you $200 as an on-call allowance, which we think is very small. And then this on-call allowance is not compulsory on anybody. I can be in the facility and say, well, this $200 doesn't worth anything. So what is more important for me to go and waste my time on $200 is when I have other important things to do. But out of humanity and our love for the job and passion, nurses will still go ahead with this and then do their level best to save the lives of the mother and the unborn child. So we realize that these are not fair. And also the midwives also will be in the labor ward 24 hours from morning to morning, taking care of this patient. And also the same thing, at the end of the month you give them $200. So we engage the Ministry of Health. We prepare our own allowance scheme, presented to the Ministry of Health, and for consideration. We realized that the Ministry of Health informed us that the allowance was rejected at the Personnel Management Office. We made several follow-ups from the Honorable Minister himself down to the Secretary General and Head of Civil Service. Under the instruction of the Ministry of Health, they invited us for a meeting with the senior management team. We honored the invitation. We went there to see how we will work together, and they informed us that they don't want to address this in a piecemeal. Like, for example, nurses will come with their problem, later other healthcare workers. They informed us that they want to have a comprehensive allowance scheme for the entire health workers at the Ministry of Health. That was a good start. We really welcome the ideas. Myself, with my other colleagues, the president and the team, we worked with the Ministry of Health for more than a month. We came up with a comprehensive allowance scheme for the entire health system, healthcare workers. And this, we were with the belief and the hopes that this will be approved by the Personnel Management Office. Then we met the Secretary General and Head of Civil Service. he promised us that he's going to work with the Honorable Minister. And in fact, he said he will request a copy from the ministry so that he can work with the government stakeholders to expedite this process. To our dismay, few weeks ago, we made a follow-up to the Ministry of Health that this allowance was not approved by the Personal Management Office. And that means the allowance that was there decades would still remain for the nurses and midwives. So we felt that that's not fair. And then since we've exhausted all the diplomatic means, we engaged all these relevant stakeholders, and our efforts were futile. We called a press conference today to reach out to the general public, to show our frustrations, some of the things some of the challenges that we have as nurses and midwives, ranging from the issue of the allowances to the personal protective equipment that are not available at the hospital. So these are some of the things that we were talking about. And also, because we are leading a large number of people in this country, these are the nurses and midwives, we form the large majority in the health system. And we as an executive, we are just a fraction out of these people. We cannot decide for these people. That is why before any action, before anything will come up, we have to engage the general public to know our stand, to know what we stand in for. Because at the end of the day, the general membership will take the decision. And to avert any health crisis in this country, we engage the general public and give the government of the Gambia an ultimatum of 2 working days. From today until on the 28th of this month.
What happens if the ultimatum is not met?
If the ultimatum is not met, if the government did not respond to us, if the government failed to respond to nurses and midwives in this country, if we did not hear from the government of the Gambia, then the government of the Gambia will hear from nurses and midwives. And we will be on the front pages of the newspapers. And
to come to you, Fode, because this is a very serious matter, you are saying that of all the struggles that you are going through and going through all the diplomatic channels to make sure that you people are heard, it seems, like you said, they've proven to be futile. Nothing is coming out of it. But, you know, in February, the National Assembly confirmed, you know, the approval of allowances for doctors, the minister and PhD holders. What are your thoughts on that?
To be quite frank with you, I mean, out of the profession, one of the most important thing is motivation. And looking at the allowances, they are serving as source of motivation. Because if professionals are not motivated, the work cannot be actually conducted in the right way. You know, picking people or certain, you know, group of people out of the rest to actually boost up their allowance level or their salary is quite not fair. Because you are actually using that as a motivation to demotivate others, because they will see it in another way around, because they are all working in the same healthcare system, in a system wherein the bulk of the work are in fact done by majority of these nurses around. And at the end of the day, you come in and look at certain group of people, I mean certain cohort of people, and increase their allowances. So the other group of nurses around are actually seeing this as a sabotage. So at the end of the day, what will happen? They will be demotivated. And in fact, this machine, if you want it to work very well, what you have to do is to actually service it. So the allowance are actually also using to be servicing the nurses in order to motivate them, to actually tell them, look, you can do it. Keep the good work that you are doing. In fact, we know that the allowances are not enough. But yet still, if someone is working for you, at least should be a token for that particular individual to actually keep them going. You know, you tell them thank you, you motivate them in certain ways. But if this is not happening, the problem will actually increase. I mean, at the end of the day, what will happen? There will be a problem that will be very difficult to solve. Because one of the most important healthcare workers in this country are nurses and midwives. Because we actually get, from all the critical patient care, these are people that take part, a cordial part, I mean, a very important role they play in trying to ensure that the patients are actually comfort and well taken care of.
So beside the fact that those people up there are earning way more than you people, you know, a lot of people sometimes complain about the fact that the health ministry is bloated with directorates and directors. What do you think about the suggestion from some people that they should do away with them?
I think for us as nurses and midwives, regardless of the number of positions that are available at the Ministry of Health, what is more important is the quality of work. Because if you see the Ministry of Health, their responsibility is to ensure that there is a quality healthcare delivery in this country. But now, the quality healthcare delivery cannot be attained if the people doing the hands-on care are not motivated, if they lack the basic materials to work. The Gambia, I'll tell you that the Gambia health system is one of the worst health systems in Africa. We are in the system. We know that there are a lot of things that are not available in the system. Nurses are overstretched. They are doing beyond their boundaries to make sure that to satisfy the patient. All right? There are a lot of things that are not available in the hospital. Like, for example, for the past 3 to 4 months now, we've been struggling. Even a glove is not available in the hospitals. Nurses are using a single pair of gloves to perform 2 or 3 different procedures. Like, for example, you will give me a glove, a nurse will use a glove and wash it, dry it, and use it again. And this is happening.
What are the health implications of these kind of things?
This is detrimental to the health of the patient and detrimental to the health of a nurse, because a pair of gloves should be used for a single use. Like, for example, once I use this glove, is infected already. I cannot use this glove to go and medicate another patient, to go and do a procedure to another patient. Once, because we know hospital is full of what we call a hospital-acquired infections. We call it nosocomial infections. So once you are there, you are at risk of acquiring these infections. The glove is to prevent you as a health worker to not have direct contact with this infection, and also to prevent a patient, what are the infections that are on your hand will not be contacted with the patient. So now using a single glove for different procedures, you are putting the patients at higher risk. In fact, you are increasing the patient's hospital stay. And also you are putting yourself at the higher risk of getting these infections. So these are some of the things that are not available. You go to the medication side, there's no medicine available. Like when people say nurses are stealing the medicines from the hospital, I think it is important that we clear it out.
We will come to that. We will come to that. Fode, do you want to add anything to what he just said?
Yeah, exactly. I mean, this point it's very, very important, because not only the patients transferring infection from one patient to another through using single glove, but actually carrying infection from the hospital and taking it home to your family. Because you are a family man. You reach at home, you're going to be with your kids, you're going to be with your mom, you're going to be with your siblings. At the end of the day, you acquired an infection from the hospital, you carry it home, you sit on a sofa, another person just come sit beside you, carry that infection. Before you realize that you are just going to walk, instead of actually trying to prevent disease, you are carrying disease from the hospital and carrying them at your
back to society.
So this is actually, in fact, we think that we are trying to actually manage what we have. On the whole, we are trying to pressurize the health system, because that infection, when it is spread at home, there will be a lot of problems, and then the hospital at the end of the day will be overwhelmed because of the action that took place from the hospital, and then the reverse will happen. Instead of now people, reducing the number of people in the hospital, now the number will be actually increased due to the infection that you are carrying from your workplace to your house.
And now to come back to your point, because this is the mentality out there, and a lot of Gambians, and in fact, I think a few years ago, the health minister was in, very hot soup when she mentioned that, well, the healthcare workers are responsible for stealing our medicine and then opening their own pharmacies all over the country. How do you respond to this as someone in the system?
First, let me take you a little bit back. Since this COVID-19 pandemic started, we have lost 2 of our colleagues, and many more of these nurses and midwives contracted the virus along their line of duty. When they are healed, we as an association of nurses and midwives and the family members of those patients, our nurses and midwives, we are responsible for their medication. We are responsible for their fees, lab fees. We are responsible for their treatment process entirely. So where is the consideration for nurses and midwives from this government and the ministry? No single nurse or a midwife in this country has a medical insurance. Currently, we have our senior nurses, in fact, veteran nurses who spend more than 30 years in the service. They have problems with the kidney. Admitted at Edward Francis Moore Teaching Hospital, discharged home. We are still struggling to raise $80,000 for this veteran nurse to go and do a surgery at Senegal. We have a nurse who went for a kidney transplant in India. He came back, he is on a medication, and that medication is costing $10,000, and he has to be with this medication throughout his life. He has to write to us as an association to help and step in with his family members. Nurses are there who are sick. If I am sick as a nurse, I work at Edward Francis Moore Teaching Hospital. The doctor will prescribe a medication for me. Any medicine that I do not have, I'll go and buy like any other patient do. So there's no single nurse who will say, I have access to medications. Nurses don't have access to medication. We don't even go near to the medication. Medicines are the pharmacy technicians and the pharmacy assistants. So our role is when the medications are available for patients, we administer these medications. But when we are sick as nurses, we buy our own medicines. And currently, association is paying medical bill for many nurses in this country because there is no medical insurance for these people.
What does that say about our healthcare system?
That means the health is sinking.
Indeed.
The healthcare system is sinking. That is why I said Gambia's health system is one of the worst. Because us, when we are demotivated, when we had the increment of the Honorable Minister and the doctors at PhD holders allowances, we really appreciate it. We don't have any problem with it. Nurses and midwives really appreciate it. In fact, we congratulate them for that. But it is so discriminatory if you look at it. It is very unfair. Nurses are doing all the work at the hospital. No single nurse was mentioned in that allowance. And in fact, before the approval of that allowance, our allowance was presented months before that allowance was presented to the cabinet. Our allowance was presented and it was rejected. After a few months, we realized that this other allowance was approved by the cabinet. We were shocked. We wrote a letter and gave a Ministry of Health an ultimatum to respond to us. When are they going to pay these allowances? They honored our ultimatum. They responded and they wrote to us and invited us for a meeting. That's why we were going through for the past few months. So nurses don't have access to the medications. We have family members ourselves. When we are sick, when our family members are sick, we struggle to go up and down to make sure that we buy medicine for these individuals. So this is what is happening. No nurse have access to medicines in the hospitals or health centers.
To add on to that, this is the reality on ground that we don't have access to medications at the hospital. The medications are kept by the pharmacies in their department. In fact, it is a separate department from our location. You look at many times, a lot of nurses around, they have family members. In fact, sometimes you have nurses themselves that are sick. They have to struggle and get medications outside because the medications are not available at the hospital. In a particular situation wherein a nurse that was working for almost 30 years presented to a health center, per se, he was prescribed some medications, he went to the pharmacy, even a single drug he could not access. What happened is that he went home and wait for his child that was actually going to high school, that he have to send that child to go to their uncle's house to get some money so that they could get some medication.
This is someone working in the healthcare system?
Someone working in the healthcare system, already served 30 years. So what happened is before the child closed from school and here and there, you know, at the end of the day, what happened to the man? He died like a rat, sorry to say. So it's so disheartening. If today we all sit like that and said, it's not our business, we are not involved, the next day it could be myself, the following day it could be Sana. So what we could say to the people is that medications are not controlled by nurses. The medications have their own places in the hospital. And in fact, we don't have any issue around the medications. We only do our prescription, maybe in district hospital or also in health centers, but perhaps in other hospitals, the prescription is done by the doctors. But in other franchises, in district hospital and also in health centers, we only write our prescription and we send the patients to go and collect medication. We are also a victim of this, it's not available, it's not available. Even
for people who are already in the system, what is your appeal to the government of the Gambia?
For us, as the National Association of Gambian Nurses and Midwives, we have come to the conclusion. And then we've negotiated, and we are still open for negotiation. But negotiation cannot be forever. There are limitations to each and everything that we do. So we have come to the center stage. We've given an ultimatum to the government of the Gambia to respond to us on or before on Wednesday, 28th of this month. So it's left to the government now to save the Gambian people, if they have the interest to save the Gambian people. Because if the government fail to respond to us, I know Faru Network will not finish covering that program, so what will happen? So this is our
position. We looking for another sit-down strike or what?
This is the decision that will be made by the general members. And if that's what they want to do, we have no option. We will go by, and we will never leave our people in an isolation. If the general membership said yes, they want to sit down, they want to put tools down, close countrywide, complete lockdown. If that's what the general members agreed to do after Wednesday, we have no option. We will stand in for them. We will stand by them and we will support them. We will never leave them in isolation, and we will make sure that they achieve whatever they want to achieve. So come Wednesday by 4 p.m., if the ministry did not, or the government did not respond to us, then early hours of Thursday, you will hear the news from the nurses and midwives.
Yeah, really to add up onto that, perhaps other people might see this in the other way around. They could say, come on, you're saving your own people, you're dealing with your own Gambians.
Yes, because I remember the situation with the resident doctors when they had that whole sit-down strike after the minister uttered that statement. People were saying, well, you people are here to serve the people, this is unpatriotic and stuff like that.
All right,
so
that's correct. That's correct, I understood. But so, us also, we are trying to actually level the ground. Because if we actually leave the matter like that, we said, oh, it's fine, because all the nurses are demotivated. In fact, to me, right now, in the healthcare system, I spoke to a lot of people, you know, about other issues. So you will realize that about 75% of the nurses are all frustrated. What they want, they actually want to jump into the private sector. So now, we leave the matter hanging like this. We all said, oh, come on, we are serving our people. Everybody will be demotivated. At the end of the day, what will happen? The quality will not be there. You walk down into a hospital, you find perhaps other category of nurses, other category of doctors that are not actually satisfactory. So at the end of the day, what will happen is what we are running away from. Because if you want a good business, you have to invest in your business. So if you don't invest in your business, you are not expected to have a proper outcome from your business. So people are talking, and then we knew it has been going on over and over. What we want to tell people is that we want to level the ground. We are actually speaking for them. We are working for them. We are actually there for them, and we will never disappoint them. The reason why we are doing this is to actually retain our people, is to actually have a better healthcare system. Because currently, the healthcare system we are having, in fact, you walk down into a hospital, the machines that you need, even a blood pressure machine. You look at consultations that are actually lined up, perhaps consultation 3, they have only one blood pressure machine. They will keep on crisscrossing. From this room, somebody use, another person use. In fact, I went somewhere, patients are even saying, this nurse is only crisscrossing, kuntum kuntum. In Manika, they say kuntum kuntum, kuntum kuntum. So, what can you do? At the end of the day, what will you do? Before you could finish work, you'll actually walk about a kilometer within that corridor, just crisscrossing to get a thermometer, to get a blood pressure machine. You go walking here and there. So if you see another opportunity wherein your workload is very, very little, and you see that the salary they are giving you, and then the other places, perhaps they are the same. You have to weigh and balance them. So you will actually go in for the other option, because there is no much druggery in that particular system. So this is the reason why we don't want to frustrate people. We want our people to stay. We love our Gambian people. We are here for them. We will never go against them. But we have to actually regulate the system, because there is no base for this system.
Sana, what's your final word to the Gambian people before we end the show?
Thank you very much. I want to assure the entire Gambian people that nurses and midwives are always there for them. And we will always be working to the best interest of the patient that we are serving. And then we call on the government to respect the plight of nurses to avert any health crisis in this country.
Thank you very much. But before we go, I have a final question, because I just watched that Join Hands to Save a Baby donated like refrigerators to the blood transfusion services. And in there, someone mentioned that Gambia has the lowest mortality rate, if I'm right. Is that correct as a nurse? Well, it doesn't seem like accurate information, but I just want to confirm.
For a couple of months, I think you've been hearing the amount of mortality in this country. So I think that speaks for itself. Because this is all because of the unavailability of materials at the hospital. We have so many competent young nurses and midwives. I mean, look at the astonishing breakthrough that happened at Edward Francis Martinez when Dr. Keba Marina did a knee transplant. A knee replacement. He don't do it alone. He did it with my nurses. It was a collective teamwork. So that means they work together. So we have so many young, vibrant nurses who can do better if they have the material. But if the government don't care about our health system, they don't provide us with material that we need to work. That is why we have this increasing number of maternal mortality. So we've seen what happened during this, COVID-19 pandemic, when the pandemic was at its peak. We've had the number of death cases that are, and no woman should die during childbirth. No woman deserves to die during childbirth. But because if you go to the hospital, the midwives are really trying. Currently, the midwives are delivering without gloves. And this is, you are at risk of getting HIV and AIDS. You are at risk of getting hepatitis. And some of these medications for hepatitis, $10,000 is which midwife will be able to afford those medications in the country. So if these materials are not available, a nurse, the amount of energy and time that a nurse will spend to look for material, to improvise them, to save a life, is more than the amount of time that he spent in saving that patient. So basically, it's disheartening. This country, I think we can do better as a nation.
Yes, before I finally leave, coming back to the same thing, you cannot actually try to, plant, a cassava. At the end of the day, you expect to actually harvest a mango. It is quite impossible. This is self-explanatory. We have to spend in the healthcare system. Quite a number of times, there are a lot of, roads that leads to maternal death. But it is also important that the healthcare system is equipped to actually convert any issue that is actually leading to the road of maternal death. So we have to actually invest in order to actually have a better outcome.
Thank you very much for the Cisse and Sanadabo for coming through to the Fatu Network Ministry. We really appreciate it, and we will be following up on Wednesday with you people, whatever decision that you guys are